president of Moderna, Stephen Hoge. Great to talk to you today, and congratulations on yesterday's news. How many vaccines do you hope you're going to be able to get out in the short term?
Well, in the very near term, by the end of this year, we hope to be able to supply 20 million doses. And that now includes approximately 5 million that we'll be providing to the UK by March, or starting in March of next year.
In terms of the UK's access to these vaccines, is it true that Britain initially chose not to buy them back in May when other countries did?
We've had a long-standing conversation with the UK government, and so actually we've continued this conversation since early May. We were pleased to announce yesterday with the UK government that they did purchase up to 5 million doses this time, and perhaps more over time. Those have been conversations going on since May, and I can't comment on whether or not they refused or didn't purchase. Ultimately, they did.
Is it fair to say, though, that the actual clincher, the making the decision and the getting the numbers and the figures didn't actually happen until after your announcement yesterday?
It certainly accelerated it. Over the past couple of weeks, as we completed enrollment of phase 3, we actually accelerated those conversations with the UK government quite substantially. The clincher certainly was knowing the vaccine is effective at preventing COVID-19. But it's important to note that those really have been constructive conversations over the last many months. And the reason why we were able to execute an agreement so quickly yesterday was because of those constructive dialogue over that time.
So it was discussed and agreed after lunchtime. Why is it so expensive compared to, for example, the Pfizer vaccine? We think the Pfizer vaccine is going to be able to be produced, sold for around $4. Yours, it's thought about $25. Is that a right ballpark figure?
That's ballpark correct. We haven't disclosed the agreements with every of the governments, but directionally correct. Our technology is based on the new messenger RNA technology that we've been working on over the last decade. There's been a lot of work to scale that up over the last year and enable manufacturing, which is a substantial amount of investment. And so hopefully, even at $25, given the impact, both economic and social and medical impact of COVID-19, it's a quite modest health intervention compared to many of the other things that people are doing right now, including testing, which often costs much more.
Great concern about COVID, obviously, for those at high risk for medical reasons and also the elderly. Talking to an immunologist yesterday, and they said that was their real concern, wanting more information from yourselves and all of the other vaccine companies. How much of your vaccine was tested on those groups, and how confident are you that they can really benefit?
We're very confident based on the data. And so if you look at our phase 3 trial, we included up to 25% of people over the age of 65. And we included another 17% of people who were under the age of 65 who had comorbidities like diabetes or obesity that put them at very high risk of severe COVID-19 disease. And so actually over 40% of the 30,000 participants in the trial had high risk of severe COVID-19 disease. That's particularly good news because if you look at the efficacy we saw, which was 94.5% against any COVID-19, that held up across all of those groups. And in particular, there were 15 cases over the age of 65 in the study who had COVID-19. And similarly, there was a 94+% reduction in that population as well. So overall, although it's preliminary analysis, we're looking at clear evidence that the vaccine can protect those at highest risk of severe disease. The last thing I wanted to say is that we did also look at severe COVID-19 disease, and this is disease that leads to, for instance, hospitalization in an ICU or respiratory failure. And the vaccine was 100% effective at preventing severe COVID-19. So the combination of those two facts provides us great confidence. We hope great confidence to immunologists and physicians that the vaccine will protect those at greatest risk in this pandemic.
And I suppose the other big question is, how long do you think that the vaccine, once it's been administered, will actually allow the patient to be protected from COVID? You're, I believe, still carrying out tests into that. When do you think you'll be able to say?
Yes, it's an ongoing thing. So far, there's no evidence of waning immunity on the vaccine, but it's important to note that we really only have about 2 months of follow-up in these trials. We will continue to follow these subjects for up to 2 years. And so all 30,000 participants will be followed up to 2 years, even if the placebo participants eventually receive the vaccine. And we'll be updating on a regular basis to regulatory authorities and public health officials around the globe. Our hope is that given the magnitude of the efficacy we saw early on here, 100% against severe disease and 94.5% against general COVID, That augurs well that this is going to be a substantial immune response and a long-lived protection. Usually, when you see those sorts of numbers, think of the measles vaccines or other things that we've received that provide us many years of immunity. Now, we need data to prove that. I'm quite optimistic that we're looking at least a year, but hopefully much longer. Ultimately, only time will tell.
Well, indeed. And in terms of storage, much has been made of the fact that your vaccine doesn't need to be stored at such incredibly low temperatures as other vaccines that are being developed. How important is that? And do you think you can actually get that temperature even warmer?
Isn't that the hope? Yes. We would love to actually make it as easy as possible to distribute in all healthcare settings, including in perhaps the developing world. For now, what we're proud of is that the storage conditions and distribution conditions are actually pretty standard refrigeration and freezers. And so stored at -20°C, the vaccine is stable, we already know, for 6 months, possibly longer. We only have data right now to support 6 months. And that can include up to 30 days in just a refrigerator, 2 to 8°C, which really means that given we can ship very small quantities and you can store this in a refrigerator that'll exist at many GPs' offices throughout the UK or in local pharmacies, that you'll be able to distribute the vaccine into those areas of greatest need and not just into central places that have high-end infrastructure for storing it at ultra-cool temperatures. We hope over time to extend that, but ultimately the data we have today supports this sort of distribution.
And of course, for countries like the UK and America, relatively temperate climates, it's not such a massive issue, is it? But in really hot countries, this is an enormous issue. How widely distributed do you think your vaccine would be able to be in those parts of the world?
So at this point, we hope, because refrigeration is relatively common for drugs and vaccines, that it could be distributed much more broadly. But it's important to note that there's still work to do. We only have 6 months in frozen conditions and 30 days in a refrigerator. You would really love to be able to distribute refrigerated or possibly even room temperature for the hardest to reach parts of the globe. And so we have work to do, others have work to do, and this is why we're going to need multiple different vaccines to succeed. It's important to note that Pfizer and Moderna are the first through the gates here with clear efficacy data from phase 3 trials. But we need others. We need the AstraZeneca Oxford vaccine. We need Janssen's vaccine. It's going to take multiple jabs to succeed at stopping this pandemic globally.
And just a final thought, obviously, a lot of different people go in to help fund these developments, don't they? Is it true that Dolly Parton helped fund your vaccine?
I don't know. I don't think so. We've received support from many, though, and so I'd have to go confirm that. But I have to admit, I don't know myself.
Vanderbilt University Medical Center, I'd read, but we certainly won't run with that.
Through one of our partners, certainly that's possible and very likely. So yes, her support through Vanderbilt. We did work with Vanderbilt in the early research of the vaccine, and we did work with them even the conduct of the clinical trials. So yes, of course, that's true through that support.